Hello everyone. Today we are covering a very important topic, marasmus and Kwashiorkor. This topic is frequently asked in NEET PG and INI-CET exam. So in this session we will break down every single point very simply so that you never get confused in exam. A 14-year-old child is brought to the pediatric clinic with complaint of bilateral pedal edema, irritability and recurrent diarrhea. On examination, the child has protruded abdomen, hepatomegaly and hyperpigmented patches interspersed with hypopigmented area on the skin, fleck sign. Subcutaneous fat is preserved and muscle wasting is only mild. Which of the following is most likely diagnosis? So option A marasmus, option B Kwashiorkor, option C vitamin A deficiency, option D iron deficiency anemia. So before discussing about each option, we will discuss about the marasmus and Kwashiorkor. Okay, so in marasmus, think of marasmus as total calories deficiency. The child is not getting enough energy at all. And in Kwashiorkor, think of Kwashiorkor as protein deficiency. Calories may still be there from carbs, but the protein is missing. Then the second and most important point is age group. Okay, so in marasmus, seen in infants less than 1 years old, so usually when breast milk is replaced too early. In Kwashiorkor, seen in older children 6 months to 3 years, often after weaning when diet is rich in carbs but poor in protein. Then let's discuss about the clinical feature. In marasmus, the thin child, no edema, severe wasting, you can see ribs muscles are gone. Then the alert but irritable. Then the skin looks loose and wrinkled like baggy pants appearance, and no fatty livers. Okay, and in Kwashiorkor's clinical feature, the swollen child, edema is the most striking feature. Okay, and the protruding abdomen due to fatty liver and low albumin. Remember that. Then the moon face in Kwashiorkor and the fleck sign in hair. Alternating light and dark bands. Okay, and in Kwashiorkor also subcutaneous fat is preserved, so they don't look as wasted, and the child is usually apathetic with loss of appetite. So here in this image, Kwashiorkor, you can see thin and brittle hair, moon face and bulging abdomen, and in marasmus you can see the simian faces and loss of muscle and mass. So like how to remember in marasmus, just remember that severe muscle wasting, then alert child and no edema. These are the most important points about marasmus. And Kwashiorkor, the most important point is edema, then the fatty liver, and a pathetic child and you can see the skin hair change. So these are the most important points. Then so here in this question, in option A is marasmus, option B is Kwashiorkor, option C is vitamin E deficiency, and option D is iron deficiency and anemia. So definitely the answer of this question is option B, Kwashiorkor, because here the child has a protubent abdomen and hyperpigmented patches interspersed with hypopigmented area on the skin, so flex sign is there, and subcutaneous fat is also preserved. So the answer of this question is option B. Thank you for watching. Please subscribe this channel. Thank you.